Dr. Banks has gone ahead and distinguished himself from all other doctors by becoming one of only 200 doctors worldwide to be certified by the Institute of Functional Medicine. Unlike traditional medicine that treats simply the symptoms or disease, Dr. Banks treats the whole person. He looks at factors such as genetics, lifestyle, the environment, in order to go ahead and prevent the onset of disease. The CDC reported last year that 600,000 people died of heart disease. Another 600,000 people died of cancer. 14 million people this year will be treated for cancer with drugs, chemotherapy, and radiation. Now, how great would it be if you were able to go ahead and prevent and stop the onset of those diseases? And that's what Dr. Banks is all about.
Functional medicine is really about the interaction of your genes with your diet, your lifestyle, and what you do to your genes during your decades of living. So a lot can be done with food. So in the book, I use food as medicine and let medicine be your food. There's a lot around diet in the book. And then there's about 170 different ailments that range the gamut from skin issues to ear issues to joint issues, autoimmune, around MS, rheumatoid arthritis, thyroid disorders, and a lot around gut. All right, when I mean gut, gastrointestinal issues. So I call myself a holistic doctor because people come to me with a whole list of problems. I know everybody's heard that before, but it's true. And as a holistic doctor, as a functionally medicine trained doctor, I'll start usually in the digestive tract with my complex patients because most people's diets are pretty poor. And if we can get them to fix their gastrointestinal tract with the right type of nutraceuticals, the right type of diet, and stop putting like gasoline on the fire, then great things can happen to people and you get better. So there's a huge chapter on digestive issues from ulcerative colitis. You might have heard the term leaky gut syndrome, diverticulitis, irritable bowel disease, irritable bowel syndrome, all those different types of digestive issues that I lay out in the book, an appropriate diet, and the top nutrients that I would use as a functional medicine trained doctor, what would be the smartest nutrients to give a patient like that. There's a lot around neurological disorders. So I've always been very intrigued by brain function, how to keep the brain healthy, keep it sharp. So if you look at my dad, as sharp as a tack. So how do you prevent disorders of MS, Parkinson's, Alzheimer's disease? You know, we say that Alzheimer's disease is a preventable disease of aging of which there is no cure. The time to fix the roof is when the sun is shining. So if we can get patients to take better care of themselves before you get the disease, that would be a lot smarter. So we look at conventional medicine, which is great. If, God forbid, I was having a heart attack, take me to the ICU right here and put me into the cardiac cath and don't tell me about fish oils and CoQ10. But to keep myself really working well, those are the nutrients that I would want to take to prevent myself from having a problem. So it's really about, cardiovascular wellness. So in the book, I lay out strategies for dyslipidemia, which is high cholesterol, or hypertension, high blood pressure. And then there's a whole section on a large epidemic. What's affecting many, many people in our country right now is the epidemic of metabolic syndrome, also known as insulin resistance syndrome, which leads to type 2 diabetes. So if I had to name the kingpin in just a matter of all diseases, it would be don't become diabetic. All right, so there are strategies there in the book for laying out a good diet around diabetes, so a low glycemic impact diet, and the top nutrients that would really be recommended for somebody with a blood sugar issue, which is a lot of people. There's a large section of the book on autoimmune disorders. We know now that autoimmune disorders are really on the rise. We look at things like MS, rheumatoid arthritis, the thyroid disorders, the Graves' disease, Hashimoto's, thyroid issues, and its relationship to your food and to leaky gut. So just about every autoimmune disorder has a leaky gut component unless proven otherwise. The back part of the book, there are appendices that lay out better forms of nutrients, good herbs on homeopathy, and some really good references so that you can actually read the book as a cover to cover or a good reference guide. You know, so if you have a disorder and you wanted to look up something like treating food allergies or, taking the bite out of eating disorders, starving yeast and fungal infections, you can just go to that particular section of the book and go right to it, or you can read it from cover to cover. And I have to say that I read it a couple times already, and it's pretty good. I'd like to say that I'm very humbled by everybody being here tonight. I see a lot of good friends. I see a lot of colleagues. I see a lot of patients of mine. And who I forgot to thank, and I wanted to thank, first of all, were my patients. All right, because I've been in practice for 33 years. It's hard to believe, but 33 years practicing in Huntington, and my patients have really taught me a tremendous amount of compassion, patience, and a great way to really learn how to do things. Not that I'm experimenting on you, but rest assured that I've been on the top of the game for a long period of time. My friends know that I go to seminars all the time. I'm really constantly learning and educating myself so that I can bring a better source of health care to my patients, and that's functional medicine. So it's really not about symptom suppression medicine, but it's really about keeping your body well, the interaction of your diet and your lifestyle with your genetics to prevent chronic diseases of aging.